The normal menstrual cycle is 21 to 35 days in duration. Bleeding lasting an average of 5 days. Normal total blood flow during the period is between 25 and 80 milliliters. Heavy menstrual bleeding, previously known as menorrhagia. If menstrual bleeding is irregular, it is called metrorrhagia. Symptoms of menorrhagia. Period bleeding folds one or more sanitary pads or tampons every hour for several consecutive hours. Needing to use the second sanitary protection to control your menstrual flow. You wake up night to change sanitary protection. Bleeding lasts more than 7 days. Passing larger blood clots. Restricting daily activities due to heavy menstrual period. Symptoms of anemia, such as tiredness, fatigue, skin pale, or difficulty breathing. Causes. If menstruation is normal cycle, not irregular, and painless, then probably causes may be following conditions. Fibroids, leiomyoma, it is benign tumor, it may cause too much bleeding during menstruation. Very rarely becomes cancer, 0.1%. Coagulation defects rare, for example, von Willebrand disease. Also anticoagulation medications such as warfarin use. Endometrial cancer, cancer of the uterine lining, bleeding can also be irregular, in between periods, or after menopause. Painful excessive bleeding. Pelvic inflammatory disease. Endometriosis, when endometrial cells grow outside uterus. USWA onset 30 to 40 years. Painful bleeding. Adenomyosis, extension of the endometrial tissue into the wall of the uterus tries to shed, causing painful and abnormal bleeds, usually occurs 40 to 50 years, maybe younger. Mostly painful. Pregnancy-related complication, i.e. miscarriage. Diagnosis, medical history and vaginal ultrasonography is most helpful diagnostic method. If need be, laboratory tests or hysteroscopy may be used. Treatment, depends on underlying causes. Iron tablets may be used to treat anemia. Usually, oral combined contraceptive or progesterone-only pills may be taken for a few months, to stabilize the bleeding amount. Anti-inflammatory medication like NSAIDs may also be used. NSAIDs are the first-line medications in ovulatory heavy menstrual bleeding, resulting in an average reduction of 20 to 46% in menstrual blood flow.